Hi, everybody. Good afternoon. This is Anna and Carolyn from the Health Department. If you're logged on, you're going to be listening to a 20 to 25-minute training about volunteering safely during this COVID-19 pandemic. As far as format for this presentation goes, I know we're all still getting used to Zoom, so if all participants could just make sure that they have their camera and microphone turned off or muted for this, that would be great. We do want to be here to answer questions. So if you think of something that you want to ask during the presentation, please feel free to enter it in the Zoom chat, and we will go through those, leave a little time at the end to answer your questions. This presentation is also being recorded, so it will be posted on the Community Foundation's website after this. We'll also have a link to it on our Health Department website. So if you have technical difficulties, miss part of it, or know someone else who might want to watch it, they can always access it later. So my name is Anna, this is Carolyn, as I said. We both work for the Health Department in the Environmental Health Division. And we're coming to you from the classroom upstairs, where I can assure you we're actually sitting 6 feet apart, though this camera angle might make it look like we're a little too close for the physical distancing requirements, but we measured it out. So we're coming to you safely with tips on how to stay safe if you want to help out a friend, neighbor, or family member in a different household who might need you to go get groceries, mail, medications, or other essential goods and deliver it to their home. We know right now there's a great need for that in our community, and it will probably continue or increase as more people are uncomfortable leaving their house, or maybe are being told that they need to stay home because they have been diagnosed with the disease and are under an isolation or quarantine order. So we thank you for your interest today and hope we can summarize some of the copious amounts of information that's out there about coronavirus for you. With that, I'm going to turn off my video to minimize distractions and share with you some slides that we have. Okay. I won't bore you with a lot of basic information about COVID-19. I'm sure you've been inundated with that already. But the long story short is that the disease continues to be prevalent and spreading in most parts of the world, including Teton County. As of this afternoon, it looks like we have 62 total laboratory confirmed cases and another 28 presumptive positive cases. 0 deaths so far, but we know that COVID is here in our community. If you're looking for the most up-to-date case numbers, as well as just trustworthy sources for information, please always go back and refer to the references list we gave you at the end of the slideshow and in the informational packet that you were emailed after you registered. Those are some of the places to go to get good updates. Coronavirus is primarily transmitted through the air when an infected person coughs or sneezes, and their little respiratory droplets might land on the face or the nose of a person nearby. That other person could then inhale those infected droplets, and the virus could enter their respiratory system and replicate, leading to infection with COVID-19. Because that's the main way this virus spreads, you have been hearing all of these recommendations to try to minimize that, like wearing a cloth face covering, especially when you're out in public, maintaining physical distance from other people, and staying home as much as possible. It's also known that the virus that causes COVID-19 can survive on a variety of surfaces outside the human body for some period of time, which is still a little bit up for debate. But because we know the virus can live for a little bit on surfaces, we are taking extra precautions and recommending that everyone is cleaning and disinfecting high-touch surfaces frequently to prevent the chance that touching an infected surface and then maybe touching your face would lead to infection. If that would happen, it would be less common than the through the air person-to-person infection, but we're still making sure to be careful about cleaning and disinfecting. I think one of the most important takeaway points for volunteers, but for community members in general, is please stay home if you're sick or symptomatic. We're asking you to not volunteer or go out in public at this time if you've been diagnosed with COVID-19 or are showing symptoms of the disease. Carolyn will talk more about the symptoms to watch for later. Please also do not volunteer if you've had recent close contact with someone who has been diagnosed with the disease, or if you've traveled outside of our immediate geographic area. That's been defined in a recent health order from Dr. Riddell, our district health officer, and he's asking that people stay home for 14 days after returning from traveling outside of the state of Wyoming, Bonneville County, Idaho, and Teton County, Idaho. Finally, we're not recommending volunteering right now if you're in a high-risk group. That means that either due to your age and or underlying medical conditions, you're at higher risk for contracting the severe, like pneumatic form of this disease. So if you're curious whether or not you might be at risk, please go to cdc.gov. They have a pretty comprehensive list of underlying medical conditions that might be relevant in the context of COVID-19. All of that being said, we really don't want to discourage people from volunteering at all. We think there's a really good place for that in this COVID-19 response. We just want to make sure people know how to do it safely. So if you're healthy and you're not at high risk, we would love you to volunteer, and we want you to protect yourself while you're doing it. And the most important way to do that is by cleaning your hands often. I'm sure you are sick and tired of hearing people say, wash your hands, wash your hands, wash your hands on repeat, but it really is the most important thing. If possible, wash your hands under warm running water with soap for at least 20 seconds. If you're somewhere where you can't access a hand sink, you can definitely use hand sanitizer instead. Maybe you're standing in line at the post office. That would be a good time. And just make sure that the hand sanitizer you use contains at least 60% alcohol by volume. As a side note, the bulk hand sanitizer you've likely seen out in the community from We Are Jackson Hole or other similar community projects is fine to use. They're using an approved recipe with the required amount of alcohol. So if you see that, go ahead and use it. Additionally, you should always avoid touching your face if possible. You should clean and disinfect frequently touched surfaces. Carolyn will go over a little more later what some of those surfaces might be. And you should wear a cloth face covering while you're out in the more crowded public places that you might need to go. Face coverings for the general public right now, including volunteers, should just be something cloth. This could include those hand-sewn cloth face masks that you've seen around, or it could be something you already have in your house, like a bandana or a buff. There are some good guidelines on CDC and other places online about how to make your own face mask. Whatever you choose to wear, just be sure that it fits snugly but comfortably on your face, that you can secure it to your head with ties or ear loops. It should have more than one layer of fabric in front of your nose and mouth, if possible. That being said, make sure you can still breathe comfortably through your face covering. And you should be able to wash your face covering in warm to hot water and dry it completely without damaging it. The last important thing about face coverings is the method by which you put them on and take them off. So we have a short video from the Minnesota Department of Health demonstrating that. And you'll notice in this video, the woman is wearing a surgical style mask, which is different than the cloth face coverings we're recommending. But the same principles would apply as far as how you put it on and take it off.
Sam's patient has an upper respiratory infection. Sam knows what to do. Sam puts on a mask and enters the room. Sam? Sam performs hand hygiene. Sam secures her mask either with ties or by placing elastic ear loops around her ears. She fits the flexible band to her nose bridge, making sure it is snug to her face and below her chin. Sam knows her front of her mask is contaminated. Sam performs hand hygiene. Instead of touching the mask, she grasps the ties or elastics of the mask, carefully removing the mask without touching the front. Sam discards the mask in the waste container. Sam performs hand hygiene. Great job, Sam.
All right, so a little cheesy, but I think you get the idea. Just avoid touching the front of the mask when putting it on and taking it off. And the last thing I'll go over before I pass it over to Carolyn is gloves. We get a lot of questions about gloves in our office, and the bottom line is that if gloves are worn at all, they should be thought of as more of a secondary line of protection for you. And that's because we remember that the main way this virus is transmitted is through the air by inhaling infected droplets. So wearing gloves won't protect you from that type of transmission. What gloves could do is create a barrier between your hands and a potentially infected surface. The way that could go wrong is if you touch an infected surface with your gloved hand and subsequently touch your face, still wearing the glove. Then essentially the gloves are no better than unwashed bare hands. So if you have gloves and want to wear them, that's great. Just remember to treat them carefully and remember that when they're on, you still can't touch your face or avoid any of the other recommendations about social distancing and stuff like that. The way to use gloves properly is to wash your hands first and then use a clean pair of gloves for a single task. Maybe that's going to the grocery store and doing some shopping for your neighbor. Then after you leave the store, you would take your gloves off in such a way that they don't contaminate the outside of your hands. And then you would wash your hands or use hand sanitizer as soon as possible after removing the gloves. What I mean when I say take your gloves off in a certain way is demonstrated in this video. It's even shorter, less than a minute, just showing how you can take your gloves off safely. All right, hopefully that made some sense to you. Feel free to watch that video again. It's kind of a neat way she took off her gloves. I'm going to pass it over to Carolyn now, and Carolyn is going to go through a more detailed step-by-step list of what it might look like when you're out grocery shopping for someone, for example. So Carolyn, it's all you.
Okay. Hi everyone, my name is Carolyn. I'm going to take you through the second half of the presentation here. So really the next two slides are just an example of standard operating procedures for the grocery store, but also the same practices do apply if you're in the post office or any other kind of public space that is still open right now. So the first thing you want to do is self-monitor yourself for symptoms before beginning your shift. If you're experiencing any symptoms of COVID-19, including fever, coughing, shortness of breath, you should not leave your home and should seek medical care. However, there are a few other less common symptoms that are still associated with the virus and that we have seen. And those include sore throat, headache, any kind of GI symptoms such as nausea, vomiting, diarrhea, anything like that, you should also refrain from volunteering. So the second thing is use disinfecting wipes on non-cloth surfaces in your vehicle. So these things include your steering wheel, gear shifters, door handles, anything like that, just to prevent any kind of contamination from your house or your car that you are then taking with you into the store. Number 3, disinfect your cart or basket handle in the grocery store with a wipe or spray. So you may have seen that some stores now are starting to have a line for clean carts and a line for dirty carts. So grab one of those clean carts and just wipe it down once more, just so you know that it is properly disinfected to your satisfaction. Number 4, wash your hands prior to touching any of the goods that you are going to deliver. So if you can, wash your hands when you get to the store with warm water and soap for 20 seconds. However, if that's not possible, you may also use hand sanitizer and carry that hand sanitizer throughout your route, just in case you do come in contact with anything you may think is contaminated or touch any of those high-touch surfaces in the store, such as any of the cooler doors or cart handles, anything like that. Next, you want to practice social distancing while shopping. So make sure you keep that 6 feet of distance between you and the other shoppers. This includes not going down a crowded aisle or somewhere that could compromise that 6 feet of distance. Number 6, use paper bags. So right now we are recommending that you are not using your reusable cloth bags just because those have the potential to become contaminated by surfaces in the store. So if you can use paper bags and then either discard them or find another purpose for them. And but if you have to use cloth bags, make sure that you wash them on the warmest possible setting after each use. Number 7, bag or package groceries to prevent cross-contamination. So the last thing we want right now is a foodborne illness outbreak. So make sure that you can separate your raw meat from your ready-to-eat foods such as fresh produce or bread. This is just to prevent any contamination that may occur during transport. Number 8, make the delivery at an agreed upon time. So make sure that you coordinate with the recipient just to make sure that they will be home or will be home soon so they can bring their groceries inside and not leave them in direct sunlight or out of temperature control for too long. The time that you start your shopping in the grocery store to the time that you deliver the goods should not exceed 4 hours. And this is just to minimize the growth of bacteria on the food when it is not in proper temperature control. So this next slide here is really just about cleaning versus disinfecting. And really they are two different things. So we thought it'd be important just to make a note of that. So cleaning is removing any visible debris or dirt from the surface of your goods. That could be your milk jugs, your cans, anything like that. So to remove that dirt, just use warm soap and water. And then the second step is disinfecting. So to disinfect, that means you actually kill the germs on the surface. And to do that, you can use one of the EPA approved disinfectants. and those can be found at that link right there on the screen. But if you don't have one of those, the CDC also recommends that you use 4 teaspoons of bleach per quart of water, or a product that contains greater than 70% alcohol. However, if you are using bleach, it is important to remember that you only make as much bleach solution as you will use immediately. This is just because that the bleach will degrade over time when it's mixed with water, and it will become less effective at killing the germs on the surface. The other thing to remember is that you always follow the label instructions on whatever product you choose to use. And this includes allowing the proper contact time for whatever product you're using. And this just means that you leave the surface of your product visibly wet for a certain amount of time. And this amount of time can range from several seconds to several minutes. So in order to efficiently kill the virus that causes COVID-19, make sure that you are taking into consideration that appropriate contact time. The next slide is just some information for the recipient, in case any of you out there are a recipient. So again, make sure that you are bringing the items inside immediately after they're dropped off. This is just to limit the growth of bacteria that can grow on your food if it's out of temperature control. You can rinse unpackaged produce under running lukewarm water. And this water does not have to be scalding hot. Again, here we're not trying to kill any germs, we're just trying to remove any visible debris from the surface. Wash your hands after putting everything away. Again, we're probably going to say this a million times, but washing your hands really is one of the most important things you can do. So with warm water and soap, again, 20 seconds. Remember to clean lids before opening cans. And this is important just with soap and water. You don't want to use any kind of bleach or Clorox wipes on the lids of your cans, just to limit the possible contamination of your food by the disinfectant. So I did find an interesting point from the Poison Control Centers that said that there is a 20.4% increase in the number of exposure calls related to cleaners and disinfectants, and this was an increase from the same time last year. And although there is no definite link between exposures and COVID-19 cleaning efforts, there appears to be some kind of association with the increased use of these cleaning products. So again, you don't want to be contaminating your food with your disinfectant. Just soap and water is fine. However, kitchen counters are something that can be cleaned and disinfected. And kitchen counters have the potential to become contaminated easily. Just if you set your grocery bags down on your counters, or you're putting product packaging on your counters, those can become contaminated. So again, you can use any kind of EPA approved disinfectant on your kitchen counters, and that will disinfect them. So here is a list of general resources you can go to if you need more information on the virus or disease case numbers, anything like that. But if you have more specific questions, feel free to call our office at that phone number there, or email Anna. And at this time, we'll open it up for questions, which you can send in the chat. And we will look at those right now. Thank you.
I'm not seeing any questions so far, so we'll give it a little time. I know we started a couple minutes late, but people were still joining, so folks might want to go back and rewatch the beginning. But also, if you don't have any questions right now, we're available, and email or call us anytime.
All right, it looks like we have our first question. Do you have to be 6 feet apart with masks on? So we are recommending that if you're in a public space where you do have the potential to compromise that 6 feet of distance, that you do wear your mask. If you're in your household or you're with your immediate family, you don't have to wear a mask. Do you have anything to add to that?
Wearing a mask does not mean that you don't have to stay 6 feet apart from other people. We just recognize that sometimes in a grocery store aisle, for example, you might push that a little bit and get a little closer than you'd like to other people, hence the face mask recommendation. But wearing a mask really does not supersede the need for physical distancing from people who are not members of your same household. Hopefully that makes sense. The next question is using hand sanitizer effective on plastic gloves for reuse? I wouldn't recommend doing that. I haven't specifically looked at any studies that show, samples off of gloves after hand sanitizer. What I do know is that hand sanitizer is meant to be applied to every surface of your skin on your hands and rubbed for a pretty long time until it's dry, because that's part of the whole contact time thing for sanitizers and disinfectants. You rub it evenly over your hands until it dries. So you would have to do that to the gloves, and then also ensure that you got every crack and crevice of the gloves, which is a little hard to feel compared to when hand sanitizer is on your hands. Plus, the product is designed for human skin, so I would not recommend trying to reuse gloves in that way. I would say avoid wearing gloves if you don't have enough to change them when they become contaminated.
And again, gloves really aren't a replacement for hand washing, so it is better to wash your hands, and gloves don't really protect you, as Anna was talking about, from the virus if you touch your face with a contaminated glove.
Okay, does the virus penetrate through cloth masks?
Yes, as we have heard, they really don't offer a lot of protection unless you're wearing one of those N95 masks, which are reserved for healthcare workers. So really, the cloth face coverings are just a way of saying, like, I protect. What is it? I protect you. You protect me. Yeah, you protect me.
Essentially, I think people get confused about the purpose of the masks. The virus can penetrate through the mask, especially if there's a forceful cough or sneeze. It does limit probably how far the virus would travel, though, outside of the mask. And so the real reason you're wearing a mask is to protect other people from you. If you cough or sneeze or even are just talking, you're emitting some of those droplets, respiratory droplets. And there are so many people right now who turn out that they are COVID positive, but they're asymptomatic and haven't been tested. So you're wearing a mask just in case you have it, and you're keeping all your respiratory droplets closer into you and away from the other people around you. And that's why we're recommending wearing the masks.
In addition to the social distancing, where you still keep 6 feet. So masks don't protect people, from anyone coming into your 6 feet. So really just still keep that 6 feet, even if you have a mask on.
Yep. Next question. What's the recommendation for how often one changes their gloves when dealing with food? I think it would probably vary by what kind of food you were doing. Wyoming is a little different when it comes just to the food code. Like if you're talking about normal times, Wyoming allows bare hand contact with ready-to-eat food just because hand washing and hand hygiene is much more important than wearing gloves, because as we've mentioned, gloves can be dirty and just as dangerous as hands. But the general rule is every time you change to a different task, or every 4 hours of continuous use for the same task, or anytime they become visibly contaminated. Hopefully that helps a little.
All right, next question. Why are some people also using eye and total face protection?
I think that those folks are probably just being extra cautious. That is not recommended for the general public. They might be seeing it on medical workers or first responders like paramedics, and that's also a bloodborne pathogen consideration, especially the eye protection. So I'm wondering if people are taking cues from folks who are in direct patient care. So it probably can't hurt to wear that type of thing, but it's really not necessary for the general public in communal public spaces.
Yeah, and I would also say it probably helps people not touch their face as much, because we do know when your hands are contaminated and then you touch your face, you do run the risk of becoming infected. So if you have something there blocking, you're not necessarily going to touch your face as much.
That's a good point. Another one, does the virus travel through exhaled cigarette smoke?
That is a good question that I have not heard anyone ask before.
Me neither. I haven't heard anything about that specifically. There might be information out there on that. It's not a topic of discussion or focus in our health department right now. So I'm hoping that if that were a big risk, we would be some of the first people to hear about that. That being said, anything you exhale that's been in your lungs and your respiratory tract has your respiratory droplets in it. And the act of exhaling more forcefully than you usually would may cause your respiratory droplets to travel further than they otherwise would. For instance, there are enhanced social distancing measures recommended for people exercising because under exertion, they're breathing more heavily and spewing their respiratory droplets 10 feet or more. So I'm thinking there could be a similar phenomenon to some degree with cigarette smoke. We're going to take this last question here because I know that you all signed up to be here just till 2:30. And then please do take note of our email and phone. And if you have questions, send those to us sometime later. So the last question reads, if a volunteer is transporting meals or groceries in their vehicle in the passenger seat, is there a chance that the virus could be on the surface of the food they are transporting because of the close proximity to the driver? Should they wear a mask in that scenario?
I think this comes back to if you're sick, you should not be volunteering. So if you have that those goods next to you, regardless of how close or if you're wearing a mask, you do risk infecting the goods. So if you do have any of those symptoms that I did mention, you really shouldn't be volunteering. So that really shouldn't be a problem.
But I'd say as long as you are asymptomatic and don't think you're sick, you probably don't need to wear a mask simply when you're driving in the car with your food. Really, the mask is to protect other people from inhaling a droplet directly from your mouth. So in the case of surface transmission, that's far less common to begin with. And I don't think there's a great chance that you breathing is going to significantly contaminate the food so long as you don't think that you're sick. I've certainly seen people driving around wearing masks alone in their car, and you know, good for them if that's comfortable and they feel better because of it. But I certainly haven't heard any recommendations about wearing masks when you're by yourself or not, you know, within 6 feet of other people in public.
Yeah, and wearing a mask shouldn't be a hindrance. So if you're touching it a lot and it's uncomfortable and you're taking it on and off, and you know, so that's when your hands become contaminated too. So make sure that it's comfortable to wear.
Yeah, balance the benefits of wearing a mask with how much you're going to be putzing with it and the detriments of doing that.
Yeah.
So we'll finish on that note. We really thank you guys for being interested in volunteering. It's been really nice to watch our community respond in that way to this health crisis, and I know it will continue. We have our contact info in the handout that you got as well. So if you didn't write it down when you were looking at the slides, you should have an email copy of that. And if for some reason you don't, please get in touch with Annie Riddell at the Community Foundation. Or if you had any technical issues, you can also let Annie know. She can send you all this packet of information again.
And this recording will be posted on the health department website as well as the Community Foundation website. So if you need to go back and reference it, feel free, it'll be up soon.
Okay, you all have a good afternoon and stay safe, as they say.
Thank you.
Thanks again.